YouTube. There we go. And I'm going to start the recording, guys. Quick review. You can have some examples from me, and then we'll go into groups. Okay, so here we go. Okay, so this is Speaking Club. It's relationship building. I'm going to review with these guys to see what they remember about yesterday. And then maybe we'll do like some quick examples. And then I'm hoping to put everyone into groups to practice. So relationship building. We studied this yesterday. Does anyone remember how many relationship building categories there are in the criteria? Was there 4 or 5? What is relationship building, by the way? What is that? Relationship building is like
initiating the communication with patient.
That was the first one. Thank you, exactly right. Initiating the conversation. So this is, we studied this last week, didn't we? Introductions. What was number 2? Does anyone remember number 2 from yesterday? I should have reviewed this myself. What was number 2?
Gaining trust.
Gaining trust would be very good. Well, what about this one? Does anyone remember this one? What if I say you drink too much coffee and your lifestyle is terrible?
Do not criticize.
Judgment.
No,
That was number 3, wasn't it, yesterday? Judgmental, I think. What was number 2? Do you remember?
Showing empathy.
Demonstrate.
Not interrupt.
Yeah, respect. And don't interrupt. Don't be rude. Right?
Empathy, love.
I'm just going to say respect to keep it simple to say. So obviously not interrupting people, saying things that they don't like. So it's not, showing any respect to people. Okay, we talked about this already, but I focused yesterday on number 4, I think it was. Empathy. Now, I focused on this one because this one is the most difficult one, I think. All right. Now, do you remember the errors, the common errors that I told you about? There was 4
repetition.
Timing.
Yeah. We'll start with timing. Okay, so when you say timing, I'm going to call this one too much or too
Little.
Or wrong moment.
So timing. Yeah, it could be, I suppose it could be the wrong moment. That would be too much, wouldn't it? Yeah. So we're talking about timing. Okay. What else?
Repetition.
Repetition. So what do we mean by repetition in this situation? What do people always repeat?
Repeating the same sentence.
Always the same one. It's always, I'm sorry to hear that. Isn't that true, Amanda? Don't you hear, I'm sorry to hear that a lot?
Yes.
It's probably used too much, yeah. No, it's a great sentence. You should say that. It's very,
It's good, yeah.
But don't repeat it 5 times.
Repeating, right? For example, asking again the same question.
Well, yeah. Well, this would be part of what we're talking about, repetition. And what other problems are there? So too much, too little, repetition. What else?
Forgetting.
Empathy.
Or appropriate.
Forgetting, yeah.
Appropriate.
I have this down as strength, but you could say, appropriate. What do you mean by appropriate?
Use the right
Precise
phrases for the right problems.
Yeah, because if someone says to you, "Oh, I have a little cut on my finger here. It's just here," should you say, "I can only imagine what you're going through, Alan. That's a really terrible cut you have on your finger." That's not appropriate, is it? That would be too. That's too strong?
Yeah.
Right?
Strong.
What if you're talking to someone and their sister died? What should you say?
I'm sorry about it.
Yeah, I'm sorry.
I'm really sorry.
I'm sorry, right? So we talked, didn't we, about normal empathy yesterday and serious empathy. So this is the strength. We're talking about this. What kind of language you use. There's one other thing that doctors do a lot, and also nurses.
Forgetting before the next question.
Getting before the next question. Okay. I do this one. You probably do this as well. Okay. You're trying to think about your next question because you're thinking about information gathering, right? You're thinking, oh, I want to ask an open question or a closed question, but you're forgetting empathy. Okay. Does that mean that I should always give empathy before every single question?
No.
No,
No.
depends on situation.
Depends.
You should give the right amount, not too much, not too little. Okay. So these are the common errors, and I talked yesterday about the different phrases we use. Can you guys tell me what are normal empathy phrases? You can all shout out. What do we have?
I'm sorry to hear that.
Sorry to hear that. What else?
That's
I
quite
can understand.
understandable.
It would be
Understand.
it would be very difficult for you. Must be difficult.
Yeah. That must
I
be,
can understand.
yeah. Someone said,
I
was
do
it you? Who said yesterday? Was it Emal or someone? That's quite understandable. Was that Safi? Who said that? That's a nice.
It was not yesterday. I was not in the class.
This is a nice one. It sounds very formal. That's quite understandable, right? I can understand. I do understand that. I'm sorry to hear that. What else? I can see why you.
I can see why you.
It's difficult for you. This must be hard for you.
Can we say I can imagine it?
Yeah, well, this would be serious empathy here. Okay, so we're not going to say this for normal empathy. Now, Dr. Saki, he gave us these ones here. Why are these in green, guys? Happy to hear that.
Because it's improvement in the treatment, actually.
Yeah, is it empathy?
Not
Yes.
exactly. No.
I think it kind of is.
That's-
Maybe I'm wrong, but I feel like
Give a positive.
Like a
positive-
compliment.
yeah. What is empathy? Empathy is like showing that you understand their feelings and kind of sharing that feeling with them. So I feel like this is empathy. But anyway, the main thing here, guys, is if they say to you, I'm feeling good today. How are you? Oh, I'm feeling good. Don't say, I'm sorry to hear that, right? You have to have some positive empathy sometimes, or positive phrases at least. Okay, what about serious empathy? What were the phrases from yesterday?
I can only imagine how.
I can only
this
imagine what,
must
how,
feel for you.
yeah, I can only imagine how this must feel for you. Okay.
I can imagine how hard this is for you.
Now, I can imagine how hard. Is that right? I can imagine.
Can't.
If we say, Amanda, if I say, I can imagine how hard that is.
Well, it depends on, if you've been with me or not in the garden and you've hurt yourself, then you can imagine.
It sounds like you do. It sounds like you do totally understand, right?
Absolutely. Yeah.
What's the word missing, guys? If I say, I can imagine.
Can't.
Oh, well, you can say can't as well.
I
Exactly.
can't.
Guys, don't say I can imagine. It can be I can only imagine. That's all right. Or I can't imagine. Right, this one, I can't imagine. Right?
Just a quick thing, Alan.
Go on.
Sometimes, thank you. Sometimes when students are talking, I can't hear if they're saying can or can't. Sometimes, depending on the accent, the can might really be can't. Just, it's hard to tell. Yeah.
So maybe it's better to say can only. Is that what you mean?
Yeah, unless they can really pronounce the T and make it very distinct at the end. Yeah. I can't imagine. I like that, but sometimes I just can't tell if it's a can't or a can.
It's a very good point from Amanda there. Does that make sense to everyone? This one could be misheard if you pronounce it badly. And then if someone mishears it, then they think you're saying can, and that sounds quite funny or rude, maybe, because the point is you do not understand, right? Okay, excellent. You can also say I can only imagine. You can, if it's unexpected, we could say that must be a terrible shock for you. If someone has died, you can say please accept my condolences. What are these guys from yesterday? What else was I talking about? Does anyone remember this?
Fillers.
Fillers. What is a filler? What is a filler?
Okay, well,
Okay, so yeah, I see, right? This helps to make it sound more natural when you do your empathy. You can say, I understand, or you can say, I understand, right? Little filler noises, okay, oh, I see, or are good, okay? What else did we talk about yesterday on this? Fillers plus...
And combining.
intensifier.
You don't always have to do this, but if you want, Hussein, you could just take one from here put it and then just do two at the same time.
Yes.
So you might say, okay, Alan, I'm sorry to hear that. That must be hard for you. Right, so you can combine these things. Sorry about my Skype, guys. I'm going to turn that off now. Let me just quit Skype. Okay, so what about this one? What was this? Does anyone remember this one?
Intensifiers.
Intensifiers, right?
So
So
really,
very.
Also.
This is brilliant because it means I can
Very strong.
all of my normal empathy can be used if I use intensifiers, right? So can I have an example? Hussein, give us an example. If I say to you, Hussein, yes, my cat died yesterday and I loved him very much. What can you say?
Oh, we can say, oh, I'm so sorry that you
So
got
sorry.
there.
I'm really sorry.
Yeah, I'm really sorry to hear that, Alan. I can really, maybe even you could say with like, this must be really,
Can we say, oh, I'm sorry, please accept my condolence.
yeah, I suppose for animals, sometimes you're going to need serious empathy if it's a very serious
Yeah.
an attachment, especially for vets. If you're a vet, you need to think about it carefully. Okay, so we reviewed this yesterday. Last thing is reassurance. Can anyone remember the reassurance phrases?
Yeah.
Go on.
It's
Yes.
okay. It's normal. It is.
Try not to worry.
Not to worry, that's normal.
That's normal.
you are in good.
That's common condition.
This is common condition.
Yeah, you're in good, safe hands.
So what is the difference between reassurance and empathy? Can anyone here tell me? Because sometimes you need to do reassurance, not empathy.
The things which is very not very serious, we are going to reassure the patient, or the.
I suppose is when it's not serious. When do
But
we
which is very.
reassure people, though? Can anyone think what's the situation when I should reassure someone and not maybe give empathy necessarily?
Someone has cut his finger by a knife suddenly. That
okay, but
Before the surgery.
if I cut my finger and I say this, yeah, I cut my finger. It's no problem, doctor, but I cut my finger. Are you going to say, try not to worry, Alan?
No.
No.
What's
That's
the
before some
situation?
procedure, before operation, before some investigation.
When they feel, when they
Reassurance, something what is.
how do they feel when we need to give empathy when they feel
Worried.
Oh,
worried?
before
Anxious.
operation, before anesthesia, that's we can.
But you know what? You can be worried
Something
about
what
the
is
finger.
pending.
1 second, guys. Amanda, go on, please.
Thank you. So I mean, for example, I went to the hospital the other day in real life in Italy and for a skin infection, and it wasn't bad, but I was worried because I can't speak Italian. And so I was super worried. So it was nothing major, but I needed someone to say, okay, Amanda, I'm here to help you, even though it wasn't a serious problem. I was scared in the hospital.
Yeah, okay. Well, and that's my point, really. Even though it might not be serious. Well, guys, look, even if it's very, very serious, you could still say this is a common condition, right? Even if it's very bad, you can, like take cancer. Okay, cancer is very bad, but you can still say, look, this, many people have cancer, and you're in safe hands. Many people, you could say this, many people, beat cancer or live with cancer, right? It's the same idea, like this is normal. Many people do it. You're not the only person doing this. It can be very reassuring to say that. So it doesn't have to be serious, or it can be serious or not serious, okay? But my point, guys, is sometimes I hear people giving empathy when they should give reassurance, okay? So the difference is if they're worried or anxious, you can give reassurance. Now, we need to practice all of this today. So can I ask you first, guys, can you all just take a photograph of these notes? If you don't have them already, just take a photograph of this, because you're going to need to have this in your groups. I'll give you 5 seconds. Take a photo.
Use our website.
5, 4, 2, 1. Okay. What I want to do today, guys, is put you into groups and give you a lot of chance to practice this, but you guys are going to practice these cue cards that I have chosen today, okay? Doctors, you're going to do this one. Sorry, I know it says patient twice, but it doesn't matter, okay? What's the situation here, guys, for this cue card? This is for you, doctors. What's the situation?
Clinic.
Say that again.
Clinic. You are in the.
No, it is not visible, sir. I don't know why.
Right. But tell me more. Tell me more. What's happening here? We're in a clinic and
It's not clear. Sorry, Adam.
It's not clear. You can't see.
It's blurry, the text is blurry.
I'm having a bit of a
Yeah,
tech-
it's okay. Now
Let me share my screen so you can see it better. 1 second. Can everyone see this?
Yes.
Okay. And we can look at the doctor's card here. So 60 years old, general practices clinic. What's the problem?
The problem is knee pain.
Knee pain. Yeah. So it's perfect for a little bit of sympathy. All right. Safi, are you there, Safi?
Yes, sir.
My knee is really hurting, doctor.
I'm sorry to hear that.
Yeah, it's really painful. I've been up all night.
Oh, I'm so sorry to hear that.
Oh, stop there, guys. What's wrong with his empathy here?
If you just say, "Oh, I'm sorry," it was better. Not so sorry, because it was pain. It was
Well,
not
he's
later.
done 2 of these as well, hasn't he? He did 2 straight away. So Safi, try to. We'll have 1 of these, and then we'll have this one. Okay.
Okay.
So
Okay.
yeah, my pain's really hurting, doctor. It really hurts.
I'm sorry to hear that.
Yeah, I have not sleeping. I've been waking. I've been up all night.
Oh, that this must be hard for you.
Okay. So guys, obviously this is just a very simple example, but I want you to have variety in your language when you do this cue card. Okay, guys, this is doctors. All right. Now, Amanda might be in your group and she can give you much better feedback than this. She can listen. And remember, rule number 1 with empathy, be natural, be yourself. Okay. Don't be a robot. Don't be repetitive. Don't do it too much. Don't do it too little. Be real. Be yourself. Be a good doctor or nurse. Okay. So doctors, you're going to try this one today. Who would like the link for this cue card? Would anyone like to have a copy of this?
Yes, please.
Probably you all should have a copy, right? So I'll do this now. If you guys go to the chat, I'm going to share a link to this cue card. Anyone with this link will be able to access. You can work on this in your groups. Go to the chat now, guys, and you should see this. Where's my chat box? Here is the chat. My chat's not working. Interesting. Let me try this again. Here we go. Here's the chat. I'm having a few technical issues today, guys. Just give me 1 second. It's very slow. Okay. Does everyone see that link there?
Yes.
Okay. So that's your doctor's cue card. All right. Now, nurses, don't worry. I haven't forgotten about you, nurses. So nurses, can you see this screen here?
Yes, sir.
Okay, now nurses, you're going to do this one. Okay. What type of empathy do I need here? What's the situation?
Here is school nurse.
You're a school nurse, right?
Secondary school nurse.
And how is this patient feeling, guys?
Stressful. We have to reassure.
Yeah.
Anxious.
Now it's anxious, so we need reassurance.
Reassurance.
And empathy as well, right? Not no empathy, but you can say, try not to worry. This is very normal, but also, oh, I'm sorry to hear that. That must be difficult. I can really understand. Okay, that's understandable. So nurses, you guys can do, you can use both techniques here, right? Nurses, I'm going to give you a copy of this in the chat box. Ready? Guys, everyone go to the chat box. You're going to get a link for this here.
Okay.
So again, can I see my chat here? I just need to change my screen. Okay, nurses is here. Now, are there any questions about what we're doing today? Does anyone not understand what we're trying to do? Okay, silence. I'll take silence as we're all good. For some reason, I can't.
I don't think it's apart for nurses. in the chat box.
Yeah, that's the doctor's one. I'm trying to copy this, but my computer is being very strange. Let me try again. I've tried 5 times. Let me try again. Okay, do you see this?
Yeah.
Okay, I don't know why my computer's been, today it's all been a bit strange. Okay, so nurses and doctors, you have different things. Please, please, please remember, okay? Remember, we want variety in your language, no repetition. Don't do it too much, don't do it too little. Use your natural sense of how much empathy you should give, okay? Don't use serious empathy today because it's not a serious situation. We can practice serious empathy tomorrow, all right? Everything will be normal empathy today. You can use fillers, you can combine, you can use reassurance, okay? But these are the things we're going to work on. At the end of the class, I might take more questions or we might have a performance. It just depends on timing, okay? So I'm going to separate nurses and doctors today. It's a little bit difficult to do this, but I think it's worth it so nurses and doctors can practice specific cue cards. So what's going to happen, guys, is you're going to go into your breakout rooms, all right? As usual, one person will share their screen. You can practice the cue cards I gave you or any card you want. If you're a very experienced OET person, just choose your own ones. It's no problem. Rooms will be 1, 2, 3, 4, 5, 6, or 7 for doctors. Nurses, please choose 8, 9, 10, and 11. Okay. Now, you're going to choose your own rooms today. I know that many of you know how to do this already, but I'm going to go through anyway. All right. So let me just do this here. You should see on your screen, guys, the ability to, 1 second. Again, slight technical problems. Okay, here we go. You should see on your screen, guys, the ability to choose the room, all right? So you need to wait for about 2 minutes here because this can take a bit of time. But on your screen, if you're on your computer, you will see this. Choose that button, and then you can choose your room. If you're a doctor, you can choose. Now, guys, please note that this could be at the bottom or the top or the side, right? You're just looking for this icon here. If you're on the phone, the icon will be here. You can choose your room, okay? So please start. I can see that already 50% of the class have chosen their rooms. If this is not working for you, don't worry, I will do this manually. Don't worry, okay? Amanda, are you okay to choose your room here? Are you able to do that?
I can, yes.
Okay, so Amanda, if I say in 10 minutes I'll move you, or do you
but I cannot.
message me?
Actually, yes, because the other day you nearly moved me and I was role playing.
It sort of makes me laugh doing that, but yeah, I shouldn't do that. Okay, so just send me a WhatsApp and I'll move you when
I will. Thank you.
Cool.
Let me in a room, sir.
There's probably a few people where this doesn't work. So Hussein, do you not? Does it not work?
I choose number 4, but it's not working.
Okay, no problem. So Hussein, I can do this manually for you.
And Khushal as well, please.
Okay, great, guys. And Kushal, of course, you're a doctor.
Yeah, thank you.
So don't worry about it. So what room would you like, Hussein? What room?
Number 4, sir. Number 4 is better. The middle one.
Right. Let me just stop the recording as well because we don't.